Good evening, listeners, and welcome to Views on Health. After quite a while, I have with me on the program tonight Dr. Chathuri Suraweera, consultant psychiatrist, National Hospital of Sri Lanka in Colombo, and senior lecturer in psychiatry, Faculty of Medicine, University of Colombo. A warm welcome, Doctor, back to our studios after quite a while.
Yes, good evening.
And for the information of our listeners, we are going to focus on mental well-being, and I think it's a very a wide topic rather, and without any further ado, may I hand the microphone to you, Doctor, to tell us what is mental well-being.
Right. First, I would start like this. We all know what physical well-being is, and we know we do a lot of things to make our physical well-being better. Like we are advised to do exercise, have a healthy lifestyle, and to have a balanced diet. So it's not merely absence of disease. It's not about not having high blood pressure or diabetes or high cholesterol, but maintaining your physical fitness. So if you exercise and if you're not overweight and if you're not too thin and if you're within the body mass index, that means that you're fit, you have endurance and you can do work, and you're less likely to fall ill. For example, let's say if your diet is good, your immune system is good, so you will be less prone to get infections. So that's why that we emphasize on a well-balanced diet. Just like that, if you're within the proper height and weight range, you're less likely to get diabetes or high blood pressure. So that means it's all about maintaining your physical fitness. So if you're not maintaining your physical health, then you're more likely to get into physical ill health. That means your body is sick. But although we should be giving a lot of prominence to our mental health or mental well-being, we are not doing that. And particularly when we are facing so much of stressors, it is high time that we start giving the due emphasis to our mental well-being. So just like physical health and physical ill health, mental well-being is all about not merely not having depression or anxiety or schizophrenia, but how are you coping with things? Are you very much stressed? You might not be having a mental illness, but if you are getting stressed at each and everything, and if you are coping with things by using a little bit of alcohol, that is not very good coping, and that is not very good mental health, and that might make you more vulnerable to develop mental ill health. For example, just because you're stressed, if you start taking 1 or 2 drinks in the night, then you might end up with alcohol dependence. And let's say if you're always stressed about things, then that might lead to depression. And with the COVID-19 and with all the difficulties we are going through, there were a lot of bad things about it, yes, but there were some good things also. Like, for example, by the time the COVID came, we have lost as to what we were. We were running this rat race, getting up in the morning, going to school or going to work and coming back, and we have lost the value of our relationships. We did not have time to do exercise. We didn't have any leisure. We were just running behind monetary things, and then COVID taught us a good lesson that there are much more important things to life than merely going behind life. So leisure activities, when during the lockdown we had to stay at home, there were issues which came up. The husband and wife could no longer stay together without getting into conflicts. That's how much the mental health has deteriorated, although they did not have any mental illnesses. So basically, we have to give the due respect to mental health. That is not merely having depression or merely not having depression or anxiety, but coping better and coping using adaptive ways of coping and not getting stressed and trying to see the best of what is there. So that's what mental health and mental ill health is.
Thank you, Doctor, for the detailed explanation and by way of introduction to our topic of mental well-being, going on to mental ill health. Now, there is a sort of, I would think, a gap between the two. Mental well-being, if it is there and if one person knows how to handle his or her life and then fit into what one has to do in terms of work, family, your leisure, your other activities, and taking your responsibilities in your stride, on those lines, mentally you're steady. And then if you fail in any of those, not just one, but in multiple areas, then it goes into being mental ill health. You're not coping. You're unable to cope mentally with what you have to cope with. So from my perspective, there's a gap. How does that bridge?
It's like this.
How do you bridge it?
Yes. Now, it's like this. Now, let's say I have some issues at my workplace. The boss is being nasty or something like that. So I'm distressed. I come home with all those problems and then I keep it to myself and then I'm stressed out. I shout at my kids also. And then slowly, because my coping is not so good, because I'm using all the maladaptive coping mechanisms, getting angry and getting withdrawn from the other social support systems and so on. Let's take the same example, and then I come home and I share it with my husband or one of my close family members or my friends, or I go out with my friends and then, or I go to a walk in the afternoon. The way I have coped with these two are two different things. If I don't have anything else in my life other than work and that coping mechanism, then there is no way that I could have some positive energy there. And if that thing continues, okay, the boss scolded me and today I'm sad and I'm in a foul mood and I did not do anything to correct it. And then it goes for about 1-2 weeks. And then there might be a time where this sadness is persistent. And along with that, you might develop, you don't want to go to work, you don't have the energy, and you're not enjoying the things that you used to enjoy, and sleep difficulties, then that has become a depression. Sometimes, having said that, just merely because you're using positive coping strategies, you might not be able to cope it, because there is a genetic roles also, because mental illnesses come in people who are genetically predisposed when there is a precipitating factor. So you might not be able to correct it 100%, but then if you have other avenues of positive coping and other things other than this stressful job, then that you might be able to neutralize it. So basically, in summary, if somebody dies, if somebody who is close to you dies, you're supposed to feel sad. But that will go away, and we know it's because of the death. But if the sadness is persistent, and as I mentioned earlier, associated with other symptoms. Now, depression, although in English we say that I'm depressed, that means it's sad, but depression, clinical depression, is something else. It has to have several other symptoms as well, like feeling sad, lack of energy, not wanting to do things, not wanting to get out of the bed, sleep, appetite goes down, and you're always feeling low about yourself. Then, if it has gone to that level, obviously there's the functioning affected, as you said. You're no longer able to take care of your responsibilities. there might be an impact on yourself as well as the others. If you're a mom, you might not be able to carry out your responsibilities as a mom or as a wife. Then that's depression. But stressed, but you're able to do your work, that's normal. So we should not be medicalizing that also.
Thank you, doctor. So would you say that basically talking to somebody, sharing your issues with your family, like your spouse, maybe if your children are big enough, if they're like adult children, and they're still with you, maybe a friend, a neighbor, all that, would those help?
I would say yes and no. For mental health, to maintenance of mental health, just like exercise and everything, maintaining social interactions is very, very important. That's why a lot of people got depressed during the lockdown, because the social contact was less and we are social animals. So yes, like having a strong, healthy relationships is very, very important. On the other hand, if there are specific problems, your friends and the loved ones might not be able to help you out. And by listening to them, you might get into further trouble and you might end up getting even more stressed than you were before, because particularly because this person says something, that person says something, and so on. So while having good friendships and relationships and social relationships is very, very important, you can't be taking advice which are not scientific as well as not very, let's say, logical. Because our nature, the Sri Lankan nature is that you want to help by saying something or the other. But then that might not be actually helpful, because our people do not understand that what you don't know properly should not be told to another. So it goes both ways. So you have to be very mindful there.
So how does one know that I need to get professional help, which is what is the requirement?
Yes. Clear-cut requirement is if you're having features that I told about earlier, like if it is depression, the symptoms and signs that I told you about. And also, like, anxiety disorders are really common these days. People are so very anxious now. It's all right. Just to explain, like, about anxiety, like if there is a dog coming to bite me, I'm going to get anxious and I'm going to run now. I'm going to, like, at least do something to the dog. So my system is going to be like that, so that the heart rate is high, I would be breathing high. So that's the expected response from me. But if that response is there most of the time without a dog, so that I'm so edgy and I'm always anticipating trouble and scared of something, just imagine the mental state of that person, not relaxed at all. So that's anxiety disorder. So if these symptoms are there, you really have to seek professional help. So that's one thing. And the other thing is, like, let's say conflicts within partners. Those things sometimes better not told to a loved one who is a close person, because you tell that to the most trustworthy person and that trustworthy person tells to another trustworthy person. That's it. So when there are issues like involving another person and you have spoken to one person but the outcome is not so good, then I think again it's better to go for professional help rather than just and also, let's say I have a problem and I have been thinking about it and I can't come to a conclusion and there is no decision that I can come to it, and I might have told it to somebody else, but still I'm not very convinced about what they have been told. It's always best to go for professional help. Having said that, when it comes to professional help, a lot of people tend to think that counseling is good. Everybody's like, can't you give counseling? And there are so many counseling courses which are around, and there are so many counselors. Before going to a counselor, check whether this person is properly qualified, because I'm sorry to say most of them are not. And sometimes we see patients who have been given the advice exact advice that should not be given. It's best, I know there is a stigma, discrimination, but then it's best to go to a professionally qualified psychiatrist or a psychologist and check the qualifications when you go there, because you might end up in a worse position than you were before.
Exactly, doctor, because this happens very frequently in our society, unfortunately, and at all levels, I would think. I mean, when I mean levels, meaning social strata. And well-meaning people try to help you, but what they tell you to do may not be what you should be doing. So I can quite see what you're trying to get across to our listeners, and hope that our listeners right now will take note of what you have advised as a qualified consultant psychiatrist, that professional help needs to be sought if you have certain issues, mental issues, and not mental as in just losing it, so to speak, but if you're stressed out and you anticipate problems all the time, or you're in conflict all the time, and you cannot cope with your day-to-day affairs, then obviously you need some professional help.
Yes.
To put you right. I mean, right in the sense, not that anything wrong with you as in wrong again, but to help you to overcome it and get going with your life.
It's almost like you're slightly overweight, and it's always better to go to a nutrition specialist or to a dietitian to get professional help, so that they guide you as to what exercises to do and what diet to take. So that is about maintaining physical health. Just like that, if there are issues, because this is to do with mind, so it's about stress and how to handle stress. So they might guide you as to what exactly should be done.
Yeah, thank you, doctor. So, end of the day, I think somebody around, maybe a family member or a genuine friend, a colleague, can also recognize that in a person, be it male or female. They find that all the time they are not able to cope with a simple thing, or they react and they tend to be volatile, and it's a constant thing, it's not a one-off thing. So when at that point in time, if they take notice and they can guide the person concerned for professional help, it will be a big step in the right direction. So that, doctor, is something that if you can just speak a few words to tell our listeners what to look for. You did say that how a person can feel, but what to look for in a family member, in a colleague at work, or friends that you meet regularly, that might set you thinking, I think he or she needs some sort of professional help.
So basically, a psychiatric condition or a mental health issue is there when there's a change in the way you behave, the way you feel, or the way you think. Because it's one of the main components is the way you think. So when our thoughts change, we do not realize that our thoughts have changed. So we would not know that we are having this abnormality. So that's why most of the mental illnesses are actually observed by others, and it's the others who bring to these people to the services. Because if my thoughts have changed, I wouldn't really know. So therefore, the things that I'm going to tell is valid for if you're feeling it or if you're observing it in any other person. If you're observing it in any other person, that person might be sad than before and might be withdrawn and might not be doing well in his or her work, and not talkative, not pleasant, getting irritable at the slightest thing, not sleeping, and making mistakes, complaining of attention, concentration issues. That might be depression. If you're always anxious and always jittery and shivering and sweaty and then again, like, all over the place, and this person is not like that before, then again a red flag sign. So basically, to put it simply, if a person that has changed from what he or she was in the work, the way they talk, the way they feel, and the way they express or way they behave, you might have to think twice. That's the easiest way to say. But sometimes you yourself can identify. You're feeling sad all the time without a reason. You're feeling lazy. You don't want to go to work. And you're getting these thoughts like, I'm a loser. I'm worthless. These thoughts. So then you yourself can identify as well. But just a little word about severe mental illnesses. If that particular, because I've been talking about the common ones like the depression, anxiety, but we have to talk of the severe ones like schizophrenia, bipolar affective disorder as well. Just something interesting. If my partner is always looking out for me and is like, protecting me, like not wanting to go out, and like, he brings everything home, and he doesn't like you looking at another man, and he's checking my phone. At the initial stages, I might think that it's because he loves me a lot that these things are happening. But it's not. That's morbid jealousy. It's very common in Sri Lanka. So that's why I'm bringing this up here. So don't think that it's because your partner loves you that that you're not released to go out, and he brings everything home and you're not allowed to, and he checks your phone, checks the purse, and doesn't let you talk with your work colleagues. That's not really love. You have to be careful. And if he's always interrogating you about like other people, be careful. That might be morbid jealousy, because it might end up in domestic violence as well, and it's treatable if you are able to bring that person to the services. And in schizophrenias, like in the severe most ones, they talk of different things that they did not talk before. Like my neighbors are doing malevolent charms, or my relatives are trying to kill me. So those are the things that they would be. And they would be talking to self, smiling to self, telling that they're hearing voices or something like that. So if a person is telling like that, don't try to argue saying, no, it's not like that. That particular person actually feels that and actually believes that. So you need to get them to services. That's very, very important.
Thank you, Doctor. Time has caught up with us, and I'm reluctantly compelled to end this very interesting discussion. But let's hope that in the foreseeable future you'll be back with us to discuss other areas of mental well-being and mental ill health. Thank you very much to you, Dr. Chathuri Suraweera, consultant psychiatrist, National Hospital of Sri Lanka, and senior lecturer in psychiatry, Faculty of Medicine, University of Colombo, for sparing your valuable time to be with us on the program and sharing your expert knowledge with our listeners. Thank you so much, Doctor.
Thank you.
Thank you too to Manjula Senviratne for technical assistance. I'm Fatima Razi Khader saying good night and looking forward to your company next Monday, same time on Views on Health.